Now, still on the Diaspora Day celebration, we caught up with one of the Nigerians in diaspora who has been in Nigeria contributing to the health development of her state. Dr. Isioma Okobah, we had featured on this program as our Diasporan of the Week, where we highlighted her contribution to primary health care in Nigeria. Here is another interview that talks about her experiences in the light of Diaspora Day 2018 celebrations.
I am actually a board-certified family practice physician in Atlanta, Georgia, and also I have a master's in public health, and I also run my own medical practice called First Lithonia Medical Center in Atlanta, Georgia. And with all of that experience, I've been practicing medicine in Atlanta, Georgia for the past 15 years.
Right.
And with all of that experience, when I got a call from the executive governor of Delta State to come chair the Delta State Primary Healthcare Development Agency, that was a very humbling request, because for me, I saw that as an opportunity to bring back the wealth of experience and knowledge that I had gained in the United States of America. And prior to taking up this position, I also am the CEO of a foundation, which is actually Dr. Isioma Okobah Foundation. With the foundation for more than a decade, we had been coming home to Delta State to actually offer free medical services and also build a clinic, so there will be continuity of care for the patients in Ibodo, which is a community in Delta State. And so coming back and actually taking this position was more like giving me what I enjoy doing. Our attention had always been in the rural communities, and because we felt that there was a disparity and that inequality in the healthcare delivery in those areas needed to be bridged. And so taking this job as the chairman of the Delta State Primary Healthcare Development Agency gives me the opportunity to actually do what I love doing. And so my experience, to answer your question, so far has been awesome. It's been great because I already have been working in the rural communities.
Right.
And so now having to do all of that in the rural communities with all the primary healthcare centers has been an awesome experience. In Delta State, we currently have 444 primary healthcare centers across the 25 local government areas of Delta State.
Wow.
And so with that, we have to actually supervise all the health centers. So it's a lot of work, because we want to make sure that the infrastructure it's up to standard. We also want to make sure that the personnel are there and also delivering the services they are meant to deliver. So it takes a lot of monitoring and a lot of work for us to supervise through the whole 444 primary healthcare centers across Delta. My advice is, out there's so many Nigerian physicians out in diaspora, and a lot of them actually come home and give back. I know that in terms of like medical outreaches, some come in and do lecture students in different forms. They just need to find what they're passionate about. And if it's, some of them are specialists, and if it's the surgery part, and then you can align with your, either the state's government or the federal, because they actually have an association called the Association of Nigerian Physicians in America. And so that's a body, an umbrella that they can actually walk through, because I know that umbrella works with the Federal Ministry of Health. But if they want to do it on their own, they can actually liaise with their states and the government and the commissioners for health, and see what they can do together. And if there's an opening for them to actually fill in terms of healthcare delivery or even training of this health personnel, they can actually key into such programs. But I want to reassure them that it's a lot of fulfillment that you actually get when you have really reached the ceiling in America, Europe, anywhere in diaspora, and you come back and give that knowledge, wealth of knowledge and experience, and help improve the healthcare delivery in Nigeria as a whole. That's really amazing and fulfilling, and I would really encourage them to key in. It's really a fulfilling experience.